specialty that lifestyle medicine is a medical specialty that uses therapeutic lifestyle interventions as a primary modality to treat chronic conditions, including but not limited to cardiovascular diseases, type 2 diabetes, and obesity. So we use lifestyle first before we start with medications. Lifestyle medicine certified clinicians are trained to apply evidence-based, whole person prescriptive lifestyle changes to treat and, when used intensively, reverse such conditions. So, how do we do that? Well, by using the 6 pillars of lifestyle medicine, and we're going to talk about those more in the next couple slides, but it also, just by using those few modalities, we can provide effective prevention for these conditions as well. So, what are they? Taken simply, eat plants, keep moving, sleep well, be present, stay calm, and love people. Now we're going to dissect that a bit more in the next slide. And so when we look at nutrition from a standpoint of improving health, we're really looking at, we have the most data for a whole food plant-based diet. And then exercise, we want you to have purposeful movement that is timely and repetitive. We want to avoid substances such as tobacco and alcohol. And we want to engage in healthy relationships, so positive social connection. Stress management is the next thing that we want to work on. And then, of course, restorative sleep, which is really sleeping 7 to 9 hours a night. Now, we've been taught to do differently. But when you look at societies like the Blue Zones, who engage naturally in all of these behaviors, they live longer and they have less chronic illness. So, what are some of the actual benefits of lifestyle medicine? Well, we see decreased inflammation and improved blood flow, prevent, treat, and reverse chronic illness, which we've been talking about, improve overall health longevity. We lessen anxiety, depression, as well as improve our immunity, reduce fatigue, hunger, and insulin resistance while improving attention span and mood, and also improve physical, mental, and emotional health. And these are just some of the benefits. So in my mind, lifestyle medicine is the old new prescription for health. We have decades of data that shows, oh my goodness, hold on a second. Hold on a second. We have decades of data that actually show how lifestyle can benefit our health. Excuse me, ladies, I'm having trouble with my slides over here. Let me stop sharing for a moment. There we go. Sorry about that, ladies. Can you see my screen?
Yes.
Okay. So in taking the lifestyle pillars that we just talked about, let's look at the epidemiology of heart disease. So heart disease is the leading cause of death in women, and 1 in 5 women die daily. 3.2 million women suffered heart attacks in 2021. And unfortunately, 310,661 of them actually died from those heart attacks. So let's just sit with that for a second. What about all of the lost creativity from those women and the lost longevity of, of the things that they would teach their children and the love for their friends? We don't have to live this way. And I think that we can do better. So let's look at the types of heart disease. The number one cause of heart disease is coronary heart disease. Other types of heart disease include heart failure, aortic aneurysm, arrhythmias, which is irregular heartbeats, and hypertension. So how does it actually happen? What's the mechanism of heart disease? Well, I'm not going to give you an enormous anatomy lesson, I promise. But I'm showing you the heart on this right side of the slide because I want you to understand that everything in red is an artery, everything in blue is a vein. So this large artery coming out of the top of the heart is the is the aorta. And the aorta feeds the right coronary artery as well as the left coronary artery. And these are primarily the arteries that we talk about when we're talking about heart disease as they wrap around the heart. But surprisingly, in women, these smaller blood vessels are most affected, which is why we tend to have less obvious symptoms than our male counterparts. And the aorta is the largest artery that runs through the middle of the body, which is why when people talk about aneurysms or ruptured aneurysms, there's a significant amount of blood loss, which is why that's so dangerous. So we can't really talk about heart disease without talking about atherosclerosis, because that's really what causes heart disease. So atherosclerosis is caused by this yellow section, and these are plaques of cholesterol and materials that narrow the inside of the artery. And so you have less blood flow, which means less oxygen to the heart, causing more damage. Well, now, there was a period of time where we used to believe that this was caused by old age. Well, ultimately, that's not true. This is caused by our decisions in terms of diet. So our lifestyle choices really do prevent or reverse this damage. So in terms of symptoms, there are plenty of symptoms. Some of them are very subtle. So it can be as obvious as angina or chest pain that is dull or heavy or achy, but it could be as simple as pain in your neck or your throat or your jaw, or pain in the upper abdomen that may go through to your back, or just pain in your middle back, persistent tiredness, nausea, vomiting, shortness of breath. Or your first symptom could be your heart attack, which can be any of the above symptoms, but also indigestion or heartburn, dizziness, again, shortness of breath or swelling in your ankles and your extremities. So what are some things that we can modify in terms of risk? Cigarette smoking, high blood pressure, overweight or obesity, sedentary lifestyle, especially because that is now considered to be the new smoking in terms of heart disease risk, and diabetes. And there are things that we can do with our lifestyle, along with our medicines, if our PCP feels that we need them, to modify these risks. So in order to talk about heart disease, we really do need to have a discussion about good versus bad cholesterol. So our bad cholesterol is also called LDL, or low density lipoprotein. And this is the cholesterol that deposits into the arterial walls. That's why it's considered bad. Now, our good cholesterol is called HDL, or high density lipoprotein. And this is the cholesterol that's smaller in caliber And it also regulates how our LDL transport and promotes excretion of cholesterol. So what is cholesterol's role in the body anyway? Well, it's made in the liver, and we make 1 gram of cholesterol each day, meaning no cholesterol is actually needed from the diet. It's also used as a raw material to make hormones, such as estrogen and testosterone. It is a key ingredient in our cell membranes, and it's needed in the production of bile acids. And bile acids are super important in terms of our digestion and breakdown of cholesterol. So what elevates our LDL cholesterol? Saturated fat and trans fat, as well as the cholesterol in our diet. And saturated fat is going to be your solid oils like coconut, butter. It's also inherently in meat. Trans fats are going to be your manufactured fats, like your oils that are liquid that we use for frying. Cholesterol in food is not the same as fat. Cholesterol is found in animals primarily, and animal foods, mainly in the lean portion of meat. Essentially, there's no cholesterol in plants, and there is zero biological need for dietary cholesterol because inherently our body makes what it needs. But we've been taught to do differently. So switching gears,
Right.
Yeah, oh yeah.
let's
Just look
talk
good.
about evidence of a plant-based diet.
Right.
So our first nutritional study is the EPIC study. And this was a study that, or one of the first studies that actually looked at how people ate and what their cholesterol actually did. So as you can see, there were about 1,700, a little less than 1,700 people in this study, and they were split into meat eaters, fish eaters, vegetarians, and vegans. And ultimately, what we found was the more plant forward they ate, the less high their cholesterol was, which was great because we know that the higher your cholesterol is, the more your risk of heart disease increases. Our next study was the Framingham study, and this was completed by William Castelli and started in 1948. He started looking at heart disease in Framingham, Massachusetts. Africa, and Latin America. And what they found was the lower their cholesterol was, because in rural areas, it runs around 120 to 140, and they really don't see heart disease at all. Whereas in the United States, 107 million people actually have cholesterol over 200, and our average is actually 225. So most of our heart disease is based on our diet. So the next study was the first study looking at reversing heart disease with diet. So Dean Ornish in 1990, published in the Lancet this study called the Lifestyle Heart Trial. And it looked at 2 different arms of patients. There was a control arm, and those patients received the standard of care for heart patients. But the intervention arm was placed on a low-fat vegetarian diet, modest exercise, no smoking, and they were given stress management tools. Now, the interesting thing of this particular study is how striking it was that just by encouraging people to engage in lifestyle, how much better their parameters were. So in the experimental group, the cholesterol dropped by 24% versus the control group where it decreased only by 5%. The LDL, which is your bad cholesterol, decreased by 37% versus 3% in the standard of care group. Weight was even more striking, 22 pounds down compared to 3 pounds up within the study. And then probably the most important thing that we saw in this study was 82% disease reversal in the experimental group versus 42% in the control group. And so not only did these patients have improvement of their parameters, but they had improvement of their symptoms. So they were people that had chest pain that was fairly regular or constant. And within 3 weeks, some of them had complete reversal of their chest pain. And they started doing things that they had not done in years and being more active and having less pain. So in terms of cardiac events, you can see in the intervention group, they had far less cardiac events than in the control group. And last but not least, in 1985, Dr. Caldwell Esselstyn had a study that where he encouraged patients to avoid dairy and fish, meat, refined sugar, and excess salt, and avoided extra oils like nuts and avocado. So that sounds pretty extreme. But he also encouraged them to engage in a whole food plant-based diet, consuming 6 servings of leafy greens per day, fruit, whole grains, beans, and legumes like lentils. And what he did was he looked at their arteries during this study with something called a coronary angiogram. So if you look at our pain tube all the way to the left, you can see this nice arrow sign that we have. And you can see, looking from at the right coronary artery, that you have narrowing where the arrow is. So that was at the beginning of the study. And they were on cholesterol-lowering medicine as well. But after 60 months, you can see a significant change in this artery. 30% improvement, actually, which means they received 30% or more improved blood flow to their heart muscle. So if I haven't impressed upon you that you may want more plants in your diet, why would we want that? So it's highly effective for reducing cardiac risk factors. It reduces our risk for heart disease, type 2 diabetes, hypertension, certain types of cancer, and obesity. It also increases our fiber intake, which improves our gut health. And so eating a plant-based diet, decreasing your fat intake, especially saturated and trans fat, avoiding cholesterol, and increasing your fiber intake, especially soluble fiber, are the keys to improving our heart health. So what is soluble fiber, or what are some examples of soluble fiber? Oats, apples with the skin, barley, sweet potato with the skin, beans, and oranges. Now, if you're going to eat vegetables with the skin on them, we encourage organic when you can, or certainly significant washing. So, what are some plant-based substitutions? So, if we're substituting chicken, you may opt for tofu instead of dairy milk, since we're not baby cows. We could instead try a plant-based milk, such as soy or almond or rice milk. And then from the standpoint of the beef burger, we could instead swap for a veggie burger or vegetables actually on a bun. So what about protein? How are we going to get enough protein? I get that question a lot. Well, there are a lot of ways to get protein that aren't animal in terms of helping your cholesterol and decreasing your heart risk. Again, plant milks are a beautiful way to do that. Beans, legumes, nuts, tofu, tempeh, even quinoa, or even your brown rice does have a protein component. And so the best way to affect your lipid levels, or in terms of lowering, are to avoid meat, dairy, eggs, hydrogenated and tropical oils. But we also want to boost our good cholesterol, or our HDL, with exercise and vitamin-rich foods like citrus and peppers and kiwi. And so ideally, we'd like to keep our lipid goals less than 150 because we know that that's highly protective against coronary artery disease. Dropping our LDL target is still controversial, but the American Heart Association and the American College of Cardiology, they recommend dropping those goals, but nobody has decided how those goals will be dropped. Which is part of the controversy here in the United States. We have goals that we've been given, but they may not be low enough to really protect our risk. So this is why I really do believe that we as women need to be prepared to save ourselves. Our guidelines aren't low enough to protect us, and we have choice every day. So, New Empowerment Health is my way to support women with that. And so, I see myself as a bit of a connector. So, from a patient standpoint, I offer 30-minute, no-fee initial preventative chronic disease health assessments. And then all appointments after that are 60 minutes and in a convenient virtual format. I aim to teach you the best ways to optimize that short PCP visit. And we together develop a customized, personalized lifestyle plan. I partner with your PCP. That's a sacred relationship that I never want to break. So offering one-to-one or group formats is how we work on simplifying your lifestyle habits for your specific goals and needs. We then you will have access to virtual and in-person wellness events as well, especially if you're in the Columbia, South Carolina area. And I aim to simplify the power of lifestyle in order to treat your chronic illnesses. Now, from the provider side, my aim is to improve patient compliance by determining what's truly keeping your patient from their goals. I try to manage patient expectations so when they come to your visits, they're not asking for more than you can give them in those short visits. I support your patient with lifestyle change counseling that's not conducive to the classic provider visit. I offer a no-fee 30-minute health assessment, which really does address their rights, is appropriate for lifestyle interventions based on our current proven science. And I want them to maintain their doctor-patient relationship and for the provider to engage in all of their prescribing. I do counsel the patient that if they adopt some of these if not all of these pillars, that they may need deprescribing and to stay in touch with their primary care provider regarding that. So take care of your heart, and your heart will take care of you. Thank you for your time and your attention. I am Dr. Patrice High, and I am happy to take questions moving forward. But before I go, or before we do that, I leave you with these pictures of women and children. Women really are the gatekeepers to the health of our families, our husbands, our parents, our brothers. And so, as that, we have to take care of ourselves first so we can learn how to take care of ourselves in the next generation. Thank you very much.
Thank you.
Thank you, Dr. High, for such a wonderful and enlightening presentation. Again, thank you so much for providing us with the duly and needed information that we need during these times right now. So I want to open the floor up for any questions. If anybody have any questions, if not, I think we have our stomachs full with a lot of this great information, and you made us hungry with all those good, good looking graphics of what a plant-based diet looks like. So again, thank you guys for joining us. And we were wanting to provide you guys with just a little bit of information that you can have while taking a lunch break that you can take away with you. And again, thank you so much. And we will be in contact soon. Take care, you guys. Thank you.
Thank you. You're welcome.
You're very welcome.